So I just want to use this video to talk about using the pelvic floor muscles to support and stabilize the spine for quite a few of the exercises we use here at the Sussex Back Pain Clinic. So this is really important for things like heel slides or active straight leg raises or pelvic tilts or bridging, all those particularly motor control focused exercises. Now, it's quite crude, but the best way I can explain the usage of the pelvic floor muscles is the feeling if you were going to the toilet, urinating, having a wee, and if you had to stop the flow of urine. So most people get that quite quickly. So if you were going to the toilet and you had to stop the flow of urine, those muscles that you would use to contract to stop that are the pelvic floor muscles. So one exercise we can do is actually just train those a little bit. And any women who have had children, who have had postpartum physiotherapy will be very familiar with this. But what we can do is just practice activating and holding those muscles. So you won't be able to see anything happening really, but all you have to do is engage that feeling of stopping the flow of urine by those muscles and then just releasing. So you can perform this as an exercise in isolation, but that feeling of pelvic floor support is going to be really important for a lot of the exercises we do at the Sussex Back Pain